Okay. Assalamu alaikum, everyone, and thank you for joining today's session. My name is Mariya Moochhala, and I'm a clinical psychologist in the Department of Psychiatry. And primarily, I've been working with children and adolescents. आज का session today, we thought we'll talk about the most important, a very widely spoken about topic of learning disabilities because it affects many families, it affects many individuals, and not only so this impact is also seen in the classrooms, and yet it is often misunderstood. At the outset, I would like to say that learning difficulties or learning disabilities is not to do with the child's potential not to learn. This is a brain-based, it is brain-based. The processes are different in terms to learning of the academic skills. और जब हम academic skills की बात करते हैं, तो we are talking about the basic skills relating to reading, writing, looking into the numeracy, right? So this is how the brain is processing, and children with learning disabilities, their brain is just processing and learning these literacy skills in a different manner. So it does not reflect on their potentials. Potentials हैं, but they will not or they do not learn in the same way as any other child in a classroom setting or any other of their other siblings at home. So I think when we say that these are brain-based difficulties relating to the processes, we have to understand that these are neuronal pathways that we are looking at, and when we are looking into teaching them, that means we are reconnecting and we are creating new pathways for them. So learning disabilities can be of different types. जिस तरह मैंने अभी कहा कि processes, right, relating to reading, writing. So reading में क्या होता है? The difficulties around. So this spans across different developmental age. So there's with younger kids, if you're looking at a preschooler, schooler, like a kindergarten student, so between, say, when the time comes for the child to learn about letters, being able to recognize letters, so वहाँ से थोड़ी सी हमें signs नजर आना शुरू हो जाती है. So they have difficulties in remembering the letters or remembering the sounds of the letters, then later on moving into the decoding, being able to spell the word, being able to put it into a sequence. These are all some of the skills that they have difficulties with. So reading के अंदर बहुत सारी चीजें आती हैं. So if I am saying a word which is say if I'm saying a word, they are unable to understand the sequence of the sounds, or they have difficulty processing those sounds together. Similarly, when we come to writing, very often you must have heard the word dysgraphia. So dysgraphia is not just the ability, the motor ability to write letters. It's also to do with how the child is able to sequence those thoughts in his head and his mind, and then to narrate it onto the papers. So being able to construct a sentence, being able to put a thought in a complete fashion, also including things like punctuations, and then, of course, the spellings. So imagine, I always say, and I believe that writing is the highest order functioning of the brain. That's the CEO of the brain, because it involves a lot of other executive functions also in it, which includes things like memory. So he has to not only recall the information that perhaps he has learned, or to recall the past information, keep it in the mind, and then being able to put it on the paper. So these are some of the very complex processes. The third part is looking into the numeracy. Now, numeracy is simple चीजें हम देखते हैं कि the child's ability to count objects, or being able to do simple computation, being able to do simple concept like this is longer than, or this is more, this is less. So I'm looking at developmentally, you have to look at the learning disabilities. So these are just a common framework of when we are talking about learning disabilities and what are they. So red flags की जब अभी हमने बात की, so one of the very common things that we could look into a child is, as the child is growing, is when you see that the child is constantly guessing words, एक लाइन में उसने सही पढ़ लिया, दूसरे लाइन में उसने incorrectly पढ़ा, or he or she has difficulties in understanding directions, following directions, has difficulties in retaining maybe information that you've given. So these are some of the red flags that you can, and there are many more. So this is not an exhaustive list. And as we move on in today's session, maybe we can, mm, we can always go into the details, and maybe you can ask questions specific to this. Um, I think one of the very common myths that's around learning disabilities is, and that's a sentence that we often hear either, lots of in our environment when people say, oh, he's very smart, but he's just lazy, or he's just not putting in the effort, or if he just tried harder, things would be, he can easily do it. But we have to remember that learning disabilities is not to do with the effort. It's how the brain is functioning for that child that is making it difficult for him to process. Another thing is, I would like to clarify a little bit is that with the passage of time, it'll outgrow, or he will outgrow these difficulties. I personally feel that with learning disabilities, with the passage of time, certainly things do get better, but they get better with a lot of interventions. So how that journey is for that individual, how we make that case, then we look into early interventions. And as you read more researches and studies, it shows that early intervention with children, that means identifying the difficulties early in life and then providing them with the appropriate accommodations or required help, that leads to the success for these children. So I would like to open this platform. Maybe this is a time where I'm sure there are there are parents on this platform right now who have joined in. Maybe there are teachers. You're welcome to kind of share your whatever opinions you have or any kind of questions you hold regarding learning disabilities. We can kind of go into those. So I have one. What are the first steps recommended for parents who worry about their children's learning? Okay, so the question arises, what are those worries about your children? Now, if this is regarding, so that's a little bit, I would say, a very umbrella question, but I will try to answer it to the best of my understanding of the question. So children's difficulties can be around, for example, if you're seeing that your child is, say, 5-year-old and he's struggling with letters, or he's struggling, आपने कहा कि, oh, I just taught him yesterday this spelling, or I taught him this sound yesterday, but he has forgotten. So this is just a beginning. This is a start. And one little element like this, the forgetfulness, does not mean that the child has learning disability, but it is certainly something that you should keep as a note. Maybe you can start with a lot of, so this is one of the indication where it says, okay, this is a child who needs maybe repeated reviews. So do it repeatedly, right? So time is a very important factor. Doing repetitions are very important for such children. Again, if this is not a child who has been diagnosed, I would say that repetition really helps. Repetition helps everyone, right? So this is also one of the things that the parents can do. Something that the parents can do in early years is read to your child. Read to your child in terms of with a lot of intonations, मतलब expressions के साथ, अपने facial expressions, आपकी tone के साथ. So that helps the child's language also, the oral language also. Expression improves, vocabulary improves. So those are some of the things that I would say that you could start with an early person. But if the child is, say, in grade 2, but if you're seeing that the child is not is still not picked up the skills of reading, then I would say that consult somebody who is the expert in the field, and ideally it should be somebody, either consult, the first step should be get some more information from the teacher who are the best source, and then consult a psychologist who can help you identify where exactly the child's difficulties are and how best you can help your child. uh, the other question is, while reading to my 8-month-old baby, he snatches the books, puts it in his mouth, and sometimes tries to tear the pages. He also puts everything he sees in his mouth, such as toys, clothes, or household item. Is this behavior normal at this age? How can I teach gentle handling of the books and keep him safe without stopping his curiosity? Very interesting. This is an 8-month-old baby. An 8-month-old baby is curious, right? And they're exploring the world at the moment. So more than reading, do a lot of pictures with the child, right? And mouthing of the book is normal. It's pretty much okay. Um, so one random, I would say, a symptom or an issue is not an issue. Things are also very developmental in nature. So I think कुछ चीजें इसमें बड़ी normalcy है. How you can do is like an 8-month-old baby के साथ जब आप खाना खिलाते हैं, maybe you that's the time that you can do a lot of picture reading. So the food is already in the mouth. That sometimes reduces the chances of the book going in the mouth, right? And also it depends on how long you're doing that. The attention span is really a baby. It's an 8 month is a baby, so बहुत छोट करें उसको. Can learning difficulties appear later even if a child did well in earlier classes? Absolutely. Excellent question. Learning disabilities often get diagnosed or identified as the child sometimes move ahead, because reading has established, because they didn't have difficulties with decoding, because numeracy skills or developed as per age. It's emerging once the child crosses grade. It's the time when the complexity of the academics increases. And you see that these three, culturally also, I feel that a lot of our things are very structured. We have a lot of supports in play. In place, and suddenly by grade 4, by grade 5, we expect itna bada ho gaya hai, the child should be independent, and when those supports are suddenly taken away, that's when you see the child slipping. So absolutely, learning disabilities could be identified, because then it's a higher order learning disability. Like it could be of written expression or comprehension, like your child could be reading fluently but not understanding the text that he or she is reading, right? So yes. If a child has a diagnosed mild intellectual disability, then does it mean that he also has a learning disability like dyslexia, dyscalculia, and dysgraphia? Another very good question. So learning disabilities, remember, is not a diagnosis when a child has been diagnosed with as having intellectual impairments or intellectual deficits, right? Because intellectual deficits means that cognitive impairment hai, which means that other areas of his life are also probably behind his age and age level or grade level. So probably when it comes to his social interactions, his ability to do problem solving, maybe his overall language development, everything would be delayed. So us surat hal mein, it's not a learning disability, it's an intellectual disability. So this is a clinical way of diagnosing. If a child has a general, a delayed development in all areas right from the beginning, then the diagnosis of learning disability does not apply. How do I help my child with homework without turning it into a daily struggle or argument? So it depends on the age of the child. I think दो तीन बहुत basic चीजें होती हैं where I feel that really helps is having a few non-negotiables with the child, right? Non-negotiable means that, for instance, that you have to go to school. That's not a negotiable. you have to do your homework. That's maybe sometimes, parents have their own plan in their mind. We have our own blueprint, and then we expect the child to follow our plans, whereas the child may have their own plans, and we are not aware of that. So give a little authority and give a little, space to the child to decide what time, right? So you can have this kind of a, rule like, say, choose a time, anytime between 4 and 5. You need to tell me, right? And if the child says 4:30, then stick to it. You also stick to it and let the child start. You may give the reminder if the child is very young, say maybe a 7-year-old, an 8-year-old, you may want to, right? Dusri cheese, I think one of the things that I would like to add with learning disabilities, learning neurological diagnostics attached to it. For example, difficulties with attention, difficulties with restlessness here, right? There are children who have difficulties in sustaining to a task for more than a couple of minutes, say maybe 10 minutes or maybe sometimes even less, right? So we need to look that into or bring that into that factor also into mind when we are helping such children. So agar attention ke issues is what is causing the rift between you and your child, then I would say give breaks. And breaks should not be screen time. Breaks can be simple little games that you can play with the child while sitting at the table. But however, if your child is a restless child, I would say allow him do maybe 1 or 2 small brain gym exercise and then bring him or her back to the table. So that helps. Another question that we have is, what are the best interventions to control or overcome the stimming, repetitive behavior, restlessness, and hyperactivity in moderate ASD kids? Right. So slightly away from learning disability, but I'll be happy to answer that question. Those are a lot of typical ASD behaviors that you're looking into. I would again question the age of the child. If there is repetitive behavior, there is a lot of restlessness. You do a lot of exercises that will help with the integration and then bring the child. If you're talking in terms of bringing the child to a homework time or sitting down time, तो उसके अंदर some motor activities will help. For instance, you can do I'm not sure, I'm sure you may have had experience with the therapist. So occupational therapist also, but a lot of crab walking karate hain, or you can do a little weightlifting with him, or you may use the gym ball, right? Or you may do a little bit of hopping. Trace 8 wali exercise hoti hai. So there are lots of exercises that you could do with the child to help with the restlessness and hyperactivity. Can learning difficulties be fixed, and is it something my child will always have? As we said in the beginning of the session, learning difficulties, a child can definitely learn to overcome. However, will it completely not be there? Depends on the severity. If it is mild, then likelihood is that the child will learn the skills given the right interventions and at the right time, yes, he will be able to. But if it is something where I would say between mild to moderate degree, maybe some of them, but they will learn how to cope with it. I think that's very important to see rather than looking at learning disability and whether it can be cured. We teach skills and strategies to a child who is struggling with learning so that they learn to cope with it for the rest of their lives. How can I, sorry, I missed a question. What does an assessment actually involve? Will my child be tested or interviewed? A very pertinent question. Thank you very much, whoever asked that question. So when we come to the assessment of a child with learning disabilities, it has to be a very comprehensive. It is not just if a child comes to me, for instance, in the clinic, it's not just me assessing and giving a feedback or a report. It has to be very, very data collected. So I'll start with the data that the teacher would have, right? So collect data from the teacher, see what the teacher has noted, you as parents have noted. And sometimes the older kids are able to say that what they are finding difficult in class. Say, for instance, often teenagers can say, "Oh, I start writing, but then I get lost," for instance, right? So those are also very important pieces of information. So it is not just assessment tool that's applied. So once all this information, along with standardized tools, that all helps in kind of a very holistic and a very comprehensive picture to reach because reaching the conclusion child has learning disabilities is not easy. Asking in with reference to a child who has learning difficulties, this is also an important question. We must remember that learning disabilities does not just remain um, restrictive to his learning. It does impact children with learning difficulties. They struggle a lot. Oftentimes, they've been seen to experience anxiety. They have a low self-esteem, right? They are often bullied. They are often excluded socially. So those are very important things that one needs to look into. It's not just ke padhai. It is like how this padhai is impacting your child's overall mental health and to build the confidence. So learning disabilities does not go away overnight. It is not something depending again on the severity. It is not like you give 2 months or 3 months of help and it'll go away, right? So at the same time, you need to figure out and you need to create space for the child and for you as parents to know what the child's strengths are and help him to and allow those opportunities for him to experience those strengths of his so that that's where the confidence will come from. A child who's struggling with learning will never get confidence from school because that is not his area of strength. So his confidence will come from the areas where he can succeed. So create opportunities for that. How do I tell my daughter's teachers about her learning difficulties, and what leniency should I ask them to make? Um, so it all depends on what kind of learning difficulties your daughter has. And it's not about leniency. I would use the word accommodations or modifications, right? If a child has severe learning disabilities, then you may be looking into maybe some kind of an IEP, which stands for an individualized educational plan. It is again something that is made by a team of experts. And that's again a different way in which it is implemented in class. So I would look into what kind of difficulty she's having and what kind of accommodations do you think would help her to thrive in her class? That would be my question. Another question that has come in is, what are the recommended first steps for parents who are worried about their child's slow learning progression? The kid is 8 years old. Good question. You can ask yourself questions like, you know, can my child how much vocabulary does my child have, and what kind of slow progression are you referring to? Is it regarding reading? Is it regarding the writing? Do you feel that the child, your child is able to express orally but is not able to pen it down, or when she's writing, her spelling errors come up, whereas in isolation, she just scores maybe 9 out of 10, and sometimes 10 out of 10, and that kind of confuses you? Or is it that the child has difficulties in understanding mathematics? So, slow learning, the first part is repetition, giving time. You we cannot expect these children to be at the same pace as the classroom. So if the classroom is going very fast, you slow down if you're teaching your child. And I know you will say that, like, in what happens to the schoolwork, your schoolwork in anyways is not where the child is not performing to the school level. So unless your basic skill and your foundation skills are not solidified, there is absolutely no use of running ahead, because the child will always keep struggling. Um, Another question that has come in is, does a child have multiple learning disabilities together? Absolutely. A child can have multiple, and a child can only have one. So a child could be reading just fine, but and also be absolutely okay with the spellings, but has difficulties, say, maybe with comprehension and written expression. So those are specific learning disabilities that we are looking at. So yes, a child can have multiple too. Should my child stay in a regular school or move to a special program? Absolutely not. Your child will stay in a regular school. The schools also are very supportive. A lot of schools now, I would say, in our city have become and are aware of children's learning differences and are very supportive. They are trying to accommodate students to the best of their resources. We must understand that we come from a country where we have very limited resources in terms of specialities and in terms of providing services. So schools are trying their level best. And I hope through this session, more schools come into that fold where they can support children with learning disabilities. So, no, the child does not need to go into any kind of special school. Um, Another question is, it's a long question. Um, takes other children 20 minutes, takes my child over an hour. Is the red flag? Um, this is a red flag for my question would be, if the child is taking longer, I would look into what is it that's delaying the process. Is it that he's talking a lot in between? Is it that he's getting up with little things like, oh, I need to go and get some water, Mama, I'm hungry. Yeah, does he get distracted by maybe the doorbell or maybe another sibling walking in? Or is it that he's very slow with his writing, or that he understand the concepts, right? So these are the things that I would suggest that look into, so that you are not sitting beside your child, and the moment you move away, the child gets distracted, or he starts playing with his toys, right? Or he starts fiddling with his paper, or he starts doodling on the paper. So those are some very, very common things that we see in the child. So if the child cannot, also again, accommodations की बात जब हम करते हैं, if you see that your child is unable to work independently, it's okay to sit next to the child. It does not reflect anything bad about him or her. This is something that the child needs. This is something that we can give, right? Um, I'm not sure if I missed any question. If you can just give me. Oh, sorry, I think I missed one of the questions that came in the beginning. How long should the audio be played? So somebody has written, is it safe and beneficial to play Quran tilawat or soft poems for an 8-month-old baby? How long should the audio be played, and should it be on a low volume? Can listening to tilawat or calm poems help with language development and emotional bonding, or is complete silence better at this age? Complete silence is never good at any age. You need to talk to the child. The day the child is born, start talking, start interacting. That's a very important step with the speech development, right? Learning comes later. Any kind of talk, even when you are changing your child, talk to him, sing to him, whatever you want to sing, whether it's nursery something to do with, there is absolutely nothing which can say that it's detrimental. But more than putting on the rhymes on an audio, I would say let it be a human interaction. We are coming to an end of our session. Thank you all for joining in. I think that was some great questions that came in. Apologies if I have missed on anybody's question. Um, uh, if anyone or if you know of anyone who needs any kind of guidance, assistance, you're welcome to contact us. In the Department of Psychiatry, we do assessments for school-based assessments with an updated whole array of updated tools that are used. These are standardized tools and are tools that are recognized, internationally used tools. So you're welcome to contact us for any kind of guidance and assistance. And once again, thank you all for joining in.